Individualized pain management or personalized pain management is truly listening to one story and understanding how I can use my expertise to help them do what's important to them. When we see someone with an acute or relatively new pain, it's a great opportunity to help them heal and feel better, but maybe even more importantly, help them avoid the slippery slope of developing the disease of chronic pain. And when I meet people that have been hurt and they've had pain for a month or two, I tell them, we need to make sure that this gets treated now rather than later, because what you don't want is for this to develop into a disease where you're having to see me for the rest of your life and all that comes with it. The inability to take care of oneself, the inability to function at home, the inability to work, effects on relationships, marriages, all that's entailed within the disease of chronic pain. This is best avoided at all costs. So I'm not saying someone who got stubbed their toe yesterday needs to come in today for an urgent consultation, but if someone hurts his or her back and within a couple weeks it's not better, that's when I think someone needs to be seen by a pain expert such that a conservative plan can be put in place. We're here to sort of construct the plan, supervise the plan, monitor the plan, and then, if patients say does some physical therapy for a month or two and they come back and they say, doc, I'm still dying here, help. Then we know we need to up the ante because we're always thinking of the time clock, getting to the phase of chronic pain, which we don't want anyone to have to reach. So then we might think, okay, perhaps there's an MRI needed or an X-ray or maybe some sort of diagnostic spinal injection, anything to determine what's causing the lingering pain, because just saying your back hurts, that's not a diagnosis. We need to be better than that for patients. It's important to realize with pain that there is a time clock and that the sooner things are addressed, the better off a patient will be. CPM has a special place in the Central Connecticut community in that we're driven by passion and empathy. With our expertise can help people along in their story of life.